Welcome to another deep dive today. This time, we're going to be going over mild bacterial skin infections.
Okay.
Impetigo, erysipelas, cellulitis. You know
Wow.
the gang.
Okay.
And you're a medical microbiologist.
Oh, yeah.
So I know this might seem kind of basic.
Sure.
But we're using the World Health Organization's AWARE book
Okay.
as our guide.
Right.
And I think that adds a really interesting layer
Yeah.
even to this kind of basic topic.
Yeah, absolutely.
So ready to dive into Chapter 16 and see what gems we can unearth.
Yeah, let's do it.
So let's start with definitions.
Mm-hmm.
I always find the terminology around skin infections
Yeah.
to be a little fuzzy.
Yeah.
Like, where does impetigo end and cellulitis begin?
Right.
Does the AWARE book give us any clarity there?
It doesn't, unfortunately, give us a definitive classification system.
Okay.
It acknowledges that there isn't really universal agreement on this.
Yeah.
And I think that's something that we see in clinical practice as well.
Right.
You know, even the term ABSSI, which we see a lot, that's more of a clinical trial term
Totally.
than something we would use day to day.
Right. It's not like you're talking to your colleague and you're like,
Yeah, exactly.
I got a classic ABSSI in room 3.
Exactly.
It just doesn't happen.
Yeah, no.
But for our purposes, for this deep dive, we're really zeroing in on impetigo erysipelas cellulitis,
Yeah.
the milder end of the spectrum,
Right.
not the necrotizing fasciitis and stuff.
Yeah, we're talking about the ones that are common and potentially troublesome,
Yeah.
but not typically going to cause havoc
Right.
in the deeper tissues.
Okay, so imagine a patient walks in with a suspicious red patch on their skin.
Okay.
How do we tell if it's impetigo or erysipelas or cellulitis?
Right.
Does the AWARE book talk about that?
It does, and it really emphasizes the importance of the clinical presentation.
Okay.
So impetigo often starts with these very superficial lesions that develop the honey-colored crusts.
Yeah.
It's a classic childhood ailment, although adults can get it too. Erysipelas, on the other hand, tends to be a well-defined fiery red rash,
Okay.
often on the face or the legs,
Okay.
and it can be quite painful.
That fiery red rash sounds pretty distinctive.
Yeah.
But just to play devil's advocate, redness alone
Yeah.
doesn't necessarily mean infection.
Right.
Right? I mean, you think about something like chronic venous stasis in the legs.
Absolutely.
That can cause redness, but that's not an infection in the same sense.
That's an excellent point. So a really thorough clinical exam is absolutely crucial to rule out other possibilities.
Yeah.
And I think that's where experience and a keen eye really come into play.
For sure.
And the AWARE book actually stresses how serious facial or neck cellulitis can be.
Oh.
You know, it highlights that risk of it actually spreading to the brain.
Wow, that's scary.
Yeah, it is.
That even what seems like a simple skin infection can have
Yeah.
pretty dire consequences.
Absolutely.
So when do we bring in the microbiologist's best friend,
Okay.
the swab? Does the AWARE book talk about that at all?
It does, and surprisingly, it suggests that routine microbiology tests aren't really necessary for these mild cases.
Okay.
So oftentimes, clinical diagnosis based on that presentation is going to be sufficient.
Okay, so it's about being judicious with resources.
Right, exactly.
Not every red spot
Every red spot.
needs a trip to the lab.
Exactly.
But I'm curious, as a microbiologist, when do you really want to see a swab?
Yeah, so for me, if the lesions are purulent,
Okay.
that's a red flag.
Okay.
That suggests that there might be a staph infection, potentially MRSA.
Okay.
And that's where a culture can really help us.
Got it.
Also, in cases of chronic lesions like diabetic foot infections, which is a whole other deep dive,
Totally.
cultures are vital to rule out those multi-drug resistant organisms.
Okay, so we talked about swabs. What about other lab tests?
Sure.
Does the AWARE book recommend routine blood work?
Not really.
Right.
It pretty much echoes the general consensus that blood tests are usually reserved for cases where we suspect a more systemic infection,
Okay.
or if the patient has some other underlying health condition
Yeah,
that warrants further investigation.
So for your uncomplicated impetigo erysipelas cellulitis,
Yeah.
blood work not usually needed.
Not typically, no.
So we've ruled out routine blood work. What about imaging?
Okay.
Does the AWARE book mention using ultrasound or X-ray for these infections?
It does, but only in specific situations.
Okay.
So imaging really comes into play when there's uncertainty about the extent of the infection.
Got it.
So, for example, if we're suspecting an abscess or a deeper involvement, that's where an ultrasound or X-ray can help us figure out what to do next and maybe even lead to surgical intervention.
So it's all about using those tools strategically, not just as a reflex.
Exactly.
Okay, let's move on to treatment. which is, of course, a major focus of the Aware book.
Right.
What's the recommended approach for these mild skin infections?
So the book really emphasizes this stepwise approach. Okay.
For localized non-bullous impetigo,
Okay.
topical treatment is often our first line of defense.
Makes sense.
Mupirocin is a good option here,
Okay.
as it targets the infection directly with minimal systemic absorption.
Less systemic absorption means fewer side effects, which is always a plus.
Exactly.
But what about those cases where topical treatment's not enough?
Sure.
Or when we're dealing with erysipelas or cellulitis?
Right, that's when we turn to oral antibiotics.
Okay.
And the Aware book provides some very specific recommendations,
Okay.
highlighting that it's really important to choose antibiotics that are effective against both Streptococcus
Okay.
and Staphylococcus aureus.
Got it.
Cloxacillin and cephalexin are often preferred because they have a narrower spectrum of activity.
Which aligns perfectly with the whole antibiotic stewardship movement.
Absolutely.
Right. Use the most targeted therapy possible
Exactly.
to minimize resistance.
Yeah.
But I'm guessing MRSA throws a wrench into those plans sometimes.
Absolutely, in areas where community-acquired MRSA is prevalent.
Yeah.
Or if the patient has specific risk factors,
Yeah.
we might need to think about empiric treatment for MRSA.
Okay, so let's get into the nitty-gritty of antibiotic treatment.
Right.
I know our listeners are eager to hear those practical details.
Sure.
And the Aware book is known for its clear recommendations.
Yes.
So what are the typical dosages and durations for treating adults with erysipelas or cellulitis?
So you're right. The book is very specific about that for adults with erysipelas or cellulitis.
Yeah.
A typical course of amoxicillin clavulanic acid would be 500 milligrams plus 125 milligrams every 8 hours.
Okay.
Cephalexin is usually dosed at 500 milligrams every 8 hours.
Got it.
And for cloxacillin, it's 500 milligrams every 6 hours.
Okay. And what about for our pediatric patients?
Yeah.
The dosages must be different.
They are. Pediatric dosing is weight-based, as always.
Okay.
So for amoxicillin clavulanic acid, it's 80 to 90 milligrams per kilogram per day of the amoxicillin component,
Okay.
divided into doses given every 8 or 12 hours, depending on the child's weight.
Cephalexin is given at 25 milligrams per kilogram per dose every 12 hours.
Okay.
And cloxacillin is dosed at 15 milligrams per kilogram per dose every 6 hours.
Quite a bit of information to remember.
It is.
But good to have those specifics
Yeah.
at our fingertips.
Absolutely.
How long do these antibiotic treatments typically last?
So the Aware book recommends a standard duration of 5 days.
Okay.
But this can be adjusted
Yeah.
based on the patient's response
Of course.
and any underlying medical conditions they might have.
Makes sense.
The key is to make sure that the infection is completely resolved.
So we've covered the macroscopic view of treatment.
Right.
Let's zoom into the microscopic level now.
Okay.
How do these infections actually take hold in the skin?
So it all starts with a breach in the skin's barrier that allows bacteria to penetrate.
Okay.
And these bacteria could be from our own skin flora,
Right.
or they could be invaders from the environment.
Yeah.
Once they get in, they can spread through the lymphatic system, triggering inflammation and all those characteristic symptoms we talked about earlier.
And the depth of that invasion determines the type of infection, right?
Exactly.
Impetigo being the most superficial,
Right.
erysipelas a bit deeper, and then cellulitis,
Precisely.
reaching those deeper layers.
And here's a point that the Aware book highlights.
Okay.
Facial cellulitis can sometimes actually originate from dental infections.
Interesting.
So if you think about it, an abscess in a tooth
Yeah.
can spread to the surrounding soft tissues,
Right?
causing cellulitis.
Wow.
And in some rare cases, this can even lead to cavernous sinus thrombosis,
Oh my gosh.
which is a potentially life-threatening complication.
Wow. That's a stark reminder that even seemingly minor infections
Yeah,
can have really far-reaching consequences.
absolutely.
Well, I think we need to pause our deep dive here for now.
Okay.
Join us for part 2, where we'll explore the global epidemiology
Right.
of these infections and delve a little deeper into the challenges of diagnosis and treatment.
Sounds good. Welcome back to our exploration of mild bacterial skin infections through the lens of the WHO Aware book.
I'm eager to continue our deep dive in part 1. We focus on the clinical aspects, but now I'm curious about the global perspective.
Yeah.
Does the Aware book delve into the epidemiology of these infections?
It certainly does, while it acknowledges that skin diseases in general represent a significant global health burden.
Right.
It specifically mentions an interesting trend with cellulitis between 2005 and 2013.
Okay.
There was a notable decrease in disability-adjusted life years, or DALYs,
Dailies. Okay.
associated with cellulitis.
A decrease in dailies that's encouraging.
Yeah.
What factors contributed to this positive shift?
The book suggests that this reduction is likely due to a combination of improved hygiene practices and better access to healthcare.
That makes sense.
Leading to both fewer cases and less severe disease.
That's great.
It's a testament to the impact of public health interventions on a global scale.
That's a great reminder that even common skin infections can be influenced by broader societal factors.
Yeah.
But despite this overall improvement, I imagine certain groups are still more vulnerable.
Absolutely.
Right, the AWARE book probably addresses this as well.
It does. It emphasizes that certain risk factors can predispose individuals to developing skin infections or experiencing more severe courses. These include diabetes, peripheral arterial disease, HIV infection, and any condition that compromises the immune system.
So those underlying health issues can really tip the scales toward a more complicated course of infection.
Absolutely.
It highlights the importance of a thorough patient history, wouldn't you say?
Definitely understanding a patient's medical background can significantly influence our diagnostic and treatment approaches.
For sure. Speaking of diagnosis, we've touched upon clinical presentation.
Yeah.
But what about those instances where the picture isn't so clear?
Right.
Are there any specific challenges highlighted in the AWARE book? I'm thinking particularly about those cases where it's hard to distinguish between the different types of skin infections based on looks alone.
The book actually doesn't delve too deeply into specific diagnostic challenges. However, it does emphasize the importance of considering atypical presentations in immunocompromised individuals. Their immune systems might not mount that typical inflammatory response. So you might not see the same degree of redness or swelling or warmth.
That makes sense. Those classic signs of infection might be muted.
Exactly.
Making the diagnosis trickier.
Yeah, so clinical judgment and a high index of suspicion are crucial. Especially in those vulnerable patients.
Absolutely. It reinforces the need for a holistic approach, combining clinical acumen with appropriate laboratory testing when necessary.
For sure.
And speaking of laboratory tests, we briefly discussed microbiology tests earlier. But let's circle back to that. What guidance does the AWARE book offer regarding the use of cultures for mild skin infections?
So it reiterates the point that routine cultures aren't always needed.
Particularly for straightforward cases of impetigo erysipelas or cellulitis. However, it does advocate for cultures when MRSA is suspected. Or if the patient has risk factors for unusual pathogens.
So it's all about balancing the potential benefits of a culture with the need for judicious use of resources.
Exactly.
But I'm curious, beyond identifying the culprit, are there any other reasons why you as a microbiologist might want a culture from a skin infection?
There are definitely times when a culture provides valuable information beyond simply identifying the organism. For example, it can help us assess antimicrobial susceptibility patterns, which is crucial for guiding treatment, especially in cases of recurrent infections. Or in regions with high rates of antibiotic resistance.
That's a great point. Knowing the susceptibility patterns can help us choose the most effective antibiotic. And avoid contributing to the growing problem of resistance.
Absolutely.
Which brings us to a critical question. How does the AWARE book address the issue of antibiotic resistance?
In the context of mild skin infections.
The book underscores the importance of antibiotic stewardship as a cornerstone for combating resistance. It emphasizes the need to use antibiotics judiciously. Choosing the narrowest spectrum agent that will effectively treat the infection.
So it's about choosing the right tool for the job.
Exactly.
So to speak, not reaching for the big guns unless absolutely necessary.
Overuse of broad-spectrum antibiotics can inadvertently fuel the development of resistance, making it harder to treat infections in the long run.
And it's not just about the type of antibiotic, but also the duration of treatment,
Absolutely. The AWARE book is very specific about recommending a 5-day course for most uncomplicated cases of impetigo, erysipelas, and cellulitis. This helps ensure adequate treatment while minimizing the risk of resistance development.
So we're talking about a targeted approach, both in terms of antibiotic choice and treatment duration.
Precisely.
But I imagine that real-world scenarios often present unique challenges.
You're absolutely right. Clinical practice is rarely as straightforward as textbook cases.
Of course.
Patient compliance allergies. And the presence of complicating factors can all influence our treatment decisions.
It sounds like navigating those real-world complexities requires a blend of scientific knowledge, clinical experience, and a healthy dose of adaptability.
Couldn't agree more, and that's what makes this field so dynamic and constantly evolving.
Well said, and on that note, we'll take a short pause in our deep dive and be back to wrap things up in part 3. Welcome back to our final part of this deep dive. I feel like I've learned so much already.
Me too.
Yeah.
It's really interesting to revisit these topics with a global perspective.
Yeah, for sure. And before we wrap things up, I want to touch on something we briefly mentioned earlier.
Okay.
Topical treatments.
Right.
The Aware book actually devotes an entire section to this.
Yeah.
What were some of the key takeaways that stood out to you?
Well, they really emphasize the value of topical treatments, especially for localized impetigo. They reiterate that topical mupirocin 2% ointment applied for 5 days is a really great first-line option.
Makes sense.
Not only is it effective, but it also minimizes systemic exposure.
Right, so less risk of side effects.
Exactly.
And potentially less pressure on resistance development.
Right, and that really aligns with the overall theme of the Aware book.
Yeah, for sure. Are there any other topical agents worth mentioning?
Yeah, they do mention fusidic acid as another potential option for localized impetigo.
Okay.
And they also talk about hydrogen peroxide cream 1%.
Okay.
But they advise against its routine use.
Interesting.
What I found particularly interesting was their stance on topical corticosteroids.
Oh, yeah, they pretty much say don't use them.
Yeah, they strongly discourage using them for these infections.
As a microbiologist, why do you think that is?
Well, corticosteroids work by suppressing the immune response.
Right.
Which can be helpful for some skin conditions, but when you have a bacterial skin infection, dampening that immune response could actually backfire.
Yeah.
It might hinder the body's ability to fight off the infection.
That makes sense. So it's not just about killing the bacteria.
Right.
It's also about supporting the body's natural defenses.
Exactly. The Aware book really emphasizes a holistic approach.
For sure. And that holistic approach goes beyond just choosing the right treatment.
Yeah.
It also includes patient education and preventative measures.
Absolutely. Things like good hygiene practices, wound care, recognizing early signs of infection.
Right. All those things can help prevent those recurrences.
Exactly.
That we talked about earlier.
And of course, we can't forget about antibiotic stewardship.
Yeah, that's been a recurring theme throughout this whole deep dive.
It has. And the Aware book is really hammering home the message.
Yeah.
Choose the right antibiotic, use it appropriately, and complete the full course.
It's a shared responsibility, right?
Absolutely, both for healthcare providers and patients.
To make sure these precious antibiotics stay effective.
Exactly.
For as long as possible.
I think that really sums up the essence of the Aware book. It's more than just guidelines. It's a call to action for a more thoughtful and sustainable approach to managing bacterial infections.
Well said. Well, I think that brings us to the end of our deep dive into the world of mild bacterial skin infections.
Yeah.
With the help of the WHO Aware book.
It's been a great discussion.
It has. It's fascinating how even familiar topics can reveal new insights.
Yeah, absolutely.
When we take the time to really dig deeper.
For sure.
And for you listening out there, we hope this deep dive has given you some new knowledge.
Yeah.
And maybe even challenged some of your assumptions.
Hopefully.
Remember, even in the realm of the seemingly simple, the region that is front, there's always more to learn.
Yeah.
More to question and more to discover.
Keep those minds curious.
And keep those questions coming.
Absolutely.
Thanks for joining us.